Welcome back to Good Day Seattle. 2 horses in our state have now been diagnosed with equine herpes virus, a disease with a wide range of complications from no symptoms to fevers and limb weakness, and in the worst case, death. This started a barrel racing tournament in Texas last month, and joining us now to discuss more is Dr. Bruno Karam, and a large animal internal medicine specialist with the Pilchuck Vet Hospital in Snohomish. Dr. Karam, thank you so much for joining us, first of all.
Absolutely. Thanks for having me.
Yeah, so, we're talking about this virus. I mean, just how much of a concern should it be, and how serious is it?
It's definitely a big concern, and it is pretty serious, mostly because of the contagious nature and the high fatality rate for horses that get affected with that variant that causes neurological signs. As far as the virus itself, it's a pretty common virus. All horses in North America have been exposed to it at some point in their lives. It's a worldwide virus. We know a lot about it. They usually get it at a very young age, but there's not a whole lot of clinical signs, short of maybe fever, a cough, snotty nose. But again, once it progresses to that variant or the neurological presentation, then it can certainly be a very big deal for horses.
How does something like this, the outbreak, happen in the first place?
It has to be sort of a perfect storm, if you will, right? The virus, once the horse acquires it, it lives in their body in sort of a dormant, or what we call a latent stage. And when there's a stress in their body or in their lives, they become immunocompromised, and then they can shed or have recrudescence. And that pattern of being possibly healthy and then shedding again is what's going to be propagating the virus through a population of horses. But when you have, hundreds of horses in an event together, that's just the perfect recipe for an outbreak. And that's usually what we see, either the normal form of the virus attacking the neurological side of things or the neuropathogenic form of it.
Now, you've been working in this field for 11 years. I mean, how would you treat something like this?
As far as our viral infections, there's not a whole lot to do in terms of stopping it. We can give them antiviral medication, which essentially stops the replication, so it can certainly decrease the time that they will shed. It can stop the virus from replicating and causing more damage within the body. But what's done already when they're sick, that's not something we can reverse. So what we aim for is providing supportive care and hopefully mitigating the effects of the virus.
You were talking about the concern about this spreading from horse to horse. I mean, just how easily does this spread, though? And can people spread it as well?
Yeah, it can spread very easily because it's aerosolized. So any nose-to-nose contact, any secretions that stay behind on either equipment or feed pans, water buckets, or stalls, it does survive in the environment. But as you mentioned, mostly us as well, we are responsible for carrying from one horse to another in our hairs, in our clothes, hands. So again, with a lot of animals, it is very easy to transmit the virus.
I think some people might be watching right now and they wonder, well, if it can be spread so easily, I mean, is there any danger or threat to the public?
Not really. So it's not we don't understand it as a zoonotic concern. So humans cannot get it from a horse. There's no reports of that happening. So even though it has a similar name to herpes, it has nothing to do with herpes in humans. It's completely different viral organism and pathophysiology.
So are there treatments, or I guess vaccines rather, that folks should be aware of for their horses?
Yeah, definitely staying up to date with vaccines it's a great thing to do. We often describe vaccines, just like sometimes in humans, as a risk-based thing. So if you have a horse that does not have a lot of contact with other horses or a closed herd, again, that risk of recrudescence and reshedding the virus is possible, but you're not going to have the sheer numbers, right? But vaccinating, what it does in a way is that it's going to decrease the amount that a horse can shed if they do get sick, and it also ameliorates the clinical signs that we see. Unfortunately, with that in mind, there's not really a vaccine product that's labeled for prevention of the neurological disease, so that's not something we can prevent. But since it is transmitted in the same form as the kind of regular equine herpes virus 1, it does maybe limit what one horse can pass to another.
Okay, and before we go, we got to ask you, any tips for farmers or ranchers who might be navigating this right now?
Yeah, I think the most important thing is what we consider biosecurity. So we obviously went through something similar with our own pandemic with COVID. And it is a similar principle where you kind of shut it down, right? You try to quarantine if you know that animals are affected. You try to minimize transportation or things coming and going. And then you do your best to be clean. You clean your equipment, you clean your hands, you don't go from one horse to another. I know they're cute and we want to touch their noses, but again, minimizing that and keeping good hygiene is a great way to prevent it from spreading.
All right, a lot of good information there, Dr. Crom. Thank you so much for joining us here on Good Day Seattle.